right. Thank you very much for joining us today, and a very warm welcome to those joining us online. Welcome to Black Excellence UK Achievers Conversation. Today we have a privilege of having a conversation with an extraordinary individual who really embodies the spirit of excellence and achievement. And we've got people joining us online, and the guest we have today has not come alone. And at some point, it would introduce, people joining him, online as well. So I just want to say, sit tight, everybody. This is going to be a remarkable journey. I have the privilege to have heard a bit about what, our special guest has been doing with his career and in his career. And honestly, it is mind-blowing. So I would say sit tight and definitely don't, switch to any other channel. So be focused in our conversation today. Before we dive in, this conversation is under the auspices of Black Excellence UK, a charity organization who strives to promote and inspire the young and the old Black generation, really challenging them to achieve greater things in life, and also acknowledging that despite the challenges that they may have, it's only their mindset, the size of their idea, that limits them from achieving what they want to achieve. So no other person embodies all that than our guest that we have today. So we're truly honored to have with us Dr. Olaleye. And I'm going to briefly introduce him to you, and then I'm sure he would do a much better introduction, than I have. So the special guest we have today on BE Achievers is Dr. Olaleye. He's a distinguished consultant, ear, nose, and throat surgeon, so ENT surgeon, renowned for his expertise in head and neck cancer surgery and pioneering approaches in transoral robotic surgery. With extensive training and accolades, including 2 prestigious head and neck cancer fellowships, a PhD in cancer studies, and a master's in public health, Dr. Olaleye is a fellow of the Royal College of Surgeons of England. He's passionate about patient care, and he utilizes innovative, minimally invasive techniques, and he also has spearheaded groundbreaking research, notably in human papillomavirus-associated cancers. He's currently directing the UHL, so University Hospital Leicester, Head and Neck Cancer Research Institute. It's a true honor to have you here with us, Dr. Olaleye, and we are really looking forward to this conversation. Before we go into the details, you've not come alone.
Yes.
Can you tell us a bit about people who might be joining us online that you've invited to this conversation today?
Well, thank you so much, Opeyemi, for inviting me and Ayo and all the team in the Black Excellence UK group. I think what you do is incredible. We need role models in the Black community, and it's great to inspire the next generation. I think today is about saying that, yes, you can do it. There is absolutely nothing you set your heart to that you can't achieve.
Wow.
It's a privilege for me to share my story. And actually what you're about to hear is a lot more about everyone who's helped me on my journey. This is about the support system that I have enjoyed, and it's not so much about me. In Nigeria, we say it takes a village. It takes a whole village to train a child and to bring the child up. So I represent a whole lot of people today. As you've very kindly said in your introduction, the University Hospitals of Leicester NHS Trust is where I work. I'm a consultant, head neck surgeon. I lead the Transoral Robotic Surgery service. So my colleagues will be joining online. So thank you to everyone joining. I'm the director of the UHL Head and Neck Cancer Research Institute, where we try and find better treatment for patients. So my colleagues are joining as well. So thank you for coming along. I am part of a few alumni groups. So my secondary school association alumni are here, Fegokosa Federal Government College of Bomashaw, and they're joining online. Shout out to you all. My university alumni group, the University of Ibadan. I finished from the College of Medicine, University of Ibadan in 2002. We call ourselves the people of UCH 98. So Pouch 98 people, Twale to you all. Everyone who's online, there's so many people, the Ibadan Medical Specialist Group. I'm the current Research and Education Secretary for IMST UK that gives back to Nigeria by helping with training and teaching students and residents in the University of Ibadan. They are here online as well. The provost and the community from the University of Ibadan will be joining online. So I just really want to say thank you to you all. And obviously, my family, my close-knit family, my mom, Mrs. Oladejo Olaleye, I know she's watching. My siblings, Olaleye, Doyin, Tofa, ABC, they're there. My amazing wife, Dr. Jaye Olaleye, who's also watching. She's been my rock. She's been steady. She's been solid. I couldn't have achieved any of this without your help, Jaye. So this is for you. So everybody who's joined, all my friends, all my close friends, it's a whole village. You're about to hear a procession of Thanksgiving.
Okay. That is truly impressive. And I think behind every glory there is a story. So what we want to go through now is, where did this all start from? It's great that you are a consultant, you're doing great things in your career, but probably, I don't know, many, many decades ago, you may not have seen this happen today, or you may have dreamt it in a way, but not necessarily understood how it would transpire. Can you take us back to Karimu Street, where it all began?
Thank you so much. So Karimu Street that you mentioned is in Surulere, in Lagos, in Nigeria. Surulere is a Yoruba word for patience yields reward. So when you're patient, your rewards will come. That's the meaning of Surulere. It couldn't be any more apt. And it's in Lagos, which is the center of excellence, Eko Nibaje. That's what we say in Lagos. And I grew up in that part of Nigeria with my siblings, Larry doing Tokwe BC, and my single mom. The story actually starts just before Karimo, because life happens to everyone. And sometimes, you get dealt a hand in life that you're not expecting, but you've got to pick up yourself and you got to go. So my single mom brought up five of us, all five of us, and we're doing incredibly well. My dad sadly left us when I was young, so it was up to my mom to bring us up. So today is a real testament to hard work and grit and belief that a better day is ahead. It is a testament to my mom's faith and endurance and her belief that we will become something in life. So to go from, a point where it was bleak and there was no one to help, and, our family surrounded us, the Olaleye families, the Balogun families, thank you to all of you. It was the entire village that supported us. So to be sat here today in the UK as a consultant in head neck surgery and as a robotic surgeon, it's pretty phenomenal to see that I could have come from those streets of Lagos where, your whole life could have changed, where you're not sure of the future. The finances were a bit difficult. My incredible mom was working 2-3 jobs. She was working in the Nigerian telecommunications industry at the time. She would go from there and go to Aguda to go and sell, her wares in the marketplace and come back home. Karimu Street brings up lots of memories. And it was a vibrant community. What I remember about Surulere was that we were all friends on the streets. We went to play 2-a-side, 3-a-side football. We're running when our parents are coming in, but they had seen us a mile away. It was a community where people, the older ones, were willing to look after the younger ones. Even when your parents aren't there, they'll say, don't do it this way. They'll give you some counsel. And it was a great place to go up. There were challenges, but it is those experiences that have made me the person I am.
Absolutely, yeah.
So I'm really grateful. So Karimu Street brings a lot of memories about endurance, about faith, about working towards your goals, and the belief that I can become a doctor, I can make it, I can be great, and it's great to be here.
Yeah, and you obviously moved on to study medicine. in the greatest university in
Greatest UI.
Nigeria, UI.
I don't want to upset anyone who hasn't gone to Ibadan. The University of Ibadan is the foremost and the strongest and the best in Nigeria.
Yeah. So what inspired you? Because there might be people looking today, probably sitting where you were, decades ago, and perhaps dreaming and aspiring someday. I mean, can you help us, paint what drew you into the medical field?
Yeah, that's an interesting question. I think my uncle, Dr. Olaleye, we've got a senior Dr. Olaleye in our family who's an obstetrician and gynecologist. I remember growing up thinking, oh, wow, this is pretty cool. It's pretty cool to be a doctor. He's a great guy. He looks after people. I've always cared for people. I'm an encourager, and I feel that I can always make a difference in people's lives. So I remember when we were in primary school in Federal Home Science Association School in Ikoyi in Lagos. And in those days, the kids would do all these plays and you would sing, I'm a doctor in my country. Doctor, some of you know me well. If you look me up and down,
you would know that is me.
Then you pose with a stethoscope and you're like, yeah, I'm a doctor. And, from those very childhood moments where you think, I can do this, I can be a doctor, I can make a difference. I think those seeds were sown. And I think as I then went along from primary school, secondary school in FGC Ogbomoso, I had people who said to me, you got the right, attitude.
Wow.
I think you care for people, you're pastoral. I think you'd be great as a doctor. Mr. Olaleye, if he's watching, he's a Unity House master in my secondary school. He was an encourager. Then obviously the University of Ibadan, the College of Medicine, where I've been strengthened by quite a lot of very strong friends who are watching online, the Pouch 98 group. And when you begin to see the burden of disease and how people struggle and the difference you can make in that pain, the light you can shed on that darkness, the people you can help by the knowledge that you have, you realize that we're called to something higher than we are. So medicine is not just about you. It's about how can you give to others? How can you support others? How can you help someone? And all the work that I do as a cancer surgeon is precisely that. Can I take cancer away and restore this patient to their families and their lives and their livelihood? That's the joy that I get. So for me, it is a real honor. It's a real privilege to look after cancer patients. And I think that's what motivates me. And so from a childhood, I've had people all around me, and I've had mentors over the way who've supported me in that journey. But it starts with a belief that you can be someone. So if there's anyone watching, any young black child, you can be that next doctor. You can be that astronaut. You can be that engineer. You can be the next greatest thing that we've ever seen.
Awesome. I mean, you talked about your uncle, the senior Dr. Olaleye. And, there's a part of, human development that sometimes you become what you see. And you called out some mentors and role models. What do you think is very important when you look at role models? Because people try and look up to some role models, and sometimes you just see that they are already up there and you think, oh, yes, I know he's a role model, but I can never be like him, or he's done so much already. And I'm sure when we go through your training and your medical field, people will really understand, your journey. But how do you advise, the younger ones or even the older ones with this concept of role models, like your uncle that you called out? Can you tell us a bit more about how that shaped and influenced your journey?
Thank you so much. It's important to have role models. Representation matters. You become what you see. If you can conceive something and you can have faith in your heart that it will happen and you're ready to work hard for it, it will happen. But it is really powerful to see someone who's like you, to say, actually, you can do it. And it's important that as a community we're able to lift each other up. We begin to talk about mentoring. So in my journey, I've been blessed to have a lot of mentors who've helped me on my journey. The mentoring and the encouragement and the belief you hear these doubts and, you have the challenges, but when someone says, no, you can actually do it, it's okay to stumble. It's okay. You will get up again and you will be great. So I've had mentors, even from my, like I mentioned, Mr. Olaleye in my secondary school. In the university, I had Dr. Adegboye, who was a cardiothoracic surgeon at the time, a Christian gentleman, and I sat with him and said, I want to do cardiothoracic surgery and stuff. But we didn't have bypass machine in those days in Nigeria. And you walk down the corridors, you see Mr. Olu Akute walking down with a bow tie, and you're like, wow, this is amazing. I'd like to be like this gentleman, looking after lots of patients who are sick on the wards, doing lots of amazing surgery. And in my academic journey, during my PhD, I had Prof. Hisham Mehana, who taught me the reins of research and how to run a head and neck cancer research institute. So he's a mentor. I've had mentors in the UK when I first started in the UK, doing, clinical attachments. This is just doing honorary jobs. No one was paying me anything, but I was gaining the experience in the UK. Mr. Ayo Oshowo in Whittington Hospital in London gave me my very first clinical attachment opportunity in the UK. So thank you to him. And he was doing, upper GI, laparoscopic surgery. I was like, wow, this is amazing. I carried on. I moved on to St. George's Hospital with Mr. Tunde Odutoye. He's my mentor. I got my very first job in the UK in the St. George's Hospital after working with them as a honorary senior house officer. And just the belief that you can, and I'm a head neck surgeon now. Tunde Odutoye is a head neck surgeon. But looking at him, their way of life, their manner, how they were, how they lifted others up, you think, wow, I'd like to be like this when I grow up. And fast forward 20 odd years, I'm a head neck surgeon now. This is back in, like 2005, 2000.
Awesome.
So I've had mentors. I think for us as a community, it's important to share our experience so people understand that it's okay to have those struggles, that you've walked their shoes before, the challenges that they're facing now, you've been there, you've been through the struggle, you can say how you managed it. And even if you've never experienced it, you can always be a listening ear. You can always encourage someone. You can always say, hey, look, it's going to be okay. It's going to be okay. Just hearing those words is pretty powerful. And I think it's important to proactively look out for others, lift others up, encourage others, lift others as you rise. So this is not just about me. This is about the next generation of Black surgeons, about the next generation of any color surgeon, of any color physician, white, brown, Black, whoever you are. If you have a dream and you're willing to work hard for it, and you've got a support structure around you, and you've got mentors, the sky is the limit. You will exceed your highest expectations. So it's important for people to seek out mentors. It's important for mentors to be willing to help others. In the University of Leicester, there's a mentoring scheme called Scrubs, where they partner a student who wants to be a surgeon with another surgeon. So I mentored 2 students at the moment, 2 Black female surgeons to be, and it's great to just share their experience and listen to them and say, if you're applying for something, look at the job description. What do you need to do? Do you need to go on a course? Do you need an elective? You're going to make it. And I think it's quite powerful. So yeah, mentoring is important.
Very good.
And I think that's the only way that you get the next generation going.
Yeah, very good. And I think you also called out, what I call the degree of your determination, because, while you were studying medicine, if you fast forward, you're now into robotics. You are like an IT doctor, tech enthusiast. It would be great for our viewers to maybe just have a bit of a chronology of how you've, with your degree of determination, you've retrained and learned, probably unlearned and relearned to where you are today and doing some fantastic thing at the University Hospital, Leicester.
Well, thank you so much. I will talk about the robotics right at the end, because that in itself is incredible teamwork. And that's not just me. That speaks to the dedication, the strength of teamwork in the University Hospital of Leicester, head neck multidisciplinary team. So thank you to all of you. It's just my privilege to lead that program. And it's great that we started our robotics program in December 2023, and it's going strong. The aim is to take out cancers through the mouth without having to split the jaw in a very complete way. The robot allows me to see the cancer clearly and to take out sufficient margin so patients, the survival is better. It means our patients' quality of life is better because they avoid chemotherapy and radiotherapy, which often is given over 6 weeks. And patients tend to have difficulty swallowing, breathing difficulties, tiredness for months and months, ringing noises, hearing loss, all those sort of issues. They have feeding tubes in their stomach, they have dental extractions. And I think the part of robotic surgery, which we will begin to see now and in the future, is that it's minimally invasive. We're not making any extra cuts. We're putting it through the mouth. Sometimes we have to make a cut in the neck to take out cancer cells from the lymph nodes. But it is only a tip of what's about to happen with artificial intelligence coming on stream as well. So it's important that everybody, you open your heart to it, to embrace change. You can't be static. You can't say this is how we've always done it for 100 years. We need to find better ways of doing things. We need to find less toxic treatment. We need to find early diagnostics. We need to find ways of diagnosing cancer through blood tests and imaging scans and things. So the robot is just a tool. And it's all about the teamwork and how we look after people, how we genuinely care for people, how we help them through their cancer journey. So in terms of my journey and my evolution from Ibadan, University of Ibadan, so my training from FDC Ogbomoso to University of Ibadan, I did my housemanship in University College Hospital Ibadan. And then I went on to do what we call a National Youth Service in Nigeria, the NYSC. So I served in Ebonyi State, in Afikpo, Ehugbo, we call it. And I was the best youth corper that year. So I got given an award by Governor Egu for my work with the communities and recognizing that there were high rates of hypertension and diabetes. And as a local doctor, patients would just come to me with stroke or with a heart attack, and they never knew that they had high blood pressure. So what I then set out to do was screen the whole community of over 1,200 people, check their blood pressure, check for blood sugars, and then started treating them. So that's why they honored me in Owana in Ebonyi State. I moved on from there to start postgraduate training in the UK with doing clinical attachments. That's just observerships, unpaid observerships, Whittington Hospital with Mr. Ayo Showo, St. George's Hospital with Tunde Odutoye. Mr. Odutoye is a head neck surgeon. I even went to Croydon, where, in Maudsley to do a bit of psychiatric. And so I have met a lot of people in my journey. I initially came from Nigeria thinking I would love to be a general surgeon like Mr. Akute. But when I got to the UK, I realized that actually the thyroid, the head neck surgery was done by a different group. I moved from that postgraduate training to basic surgical training in London. I did my core surgical training, and I will talk about some of the challenges as we go along. I then went on to do my higher specialty training in the West Midlands head neck, ENT and head neck program in Birmingham. So I trained Birmingham, Warwick, Dudley, Russell's Hall, Coventry. You just rotate a year in each hospital, spending 6 years. And in between my higher specialty training, I did a 3-year PhD. So I took some time out. I paused and I did a PhD with Prof. Mehana in University of Birmingham, looking at human papillomavirus, how it causes tonsil cancer, and how we can manage it. Basically. Then I came back into training to continue as a surgeon. And then when I finished my training, I then went on to do 2 head and neck fellowships, 2 prestigious fellowships. The first was a Royal College of Surgeons training interface fellowship in Norwich, Norfolk and Norwich University. So thank you to Mr. Stuart Burrows, Mr. Ramis, Nathis, and all the team in Norwich. And they showed me how to take cancers out, how to reconstruct. So you could take parts of the body from the wrist or the thigh, and you can join the blood vessels together and you can reconstruct things. It was a phenomenal experience. And once I finished from Norwich, I went on to Adelaide in Australia with my whole family. So Jai, my wife, and my two daughters, Ruby and Lily, went along. And we spent a whole year in Adelaide, which was amazing, with Prof. Suren Krishnan, Andrew Foreman, JC Hodge, Boaz Witadjuski, all these amazing robotic surgeons. They were the first to do robotic surgery in Australia. So I've learned from the best. So I spent a whole year learning how to use the robots, how to take cancers out well, and then came to Leicester. So I started the University Hospitals of Leicester in 2020, so just over 3.5 years. And again, I've been evolving, learning how to work in teams, learning how to build a program. Working with Mr. Peter Comboy has been a joy. He's the senior head neck surgeon in Leicester, and he's been super supportive. We've set up a program, managed Mayor, and all the fantastic head neck MDT, Macmillan nurses, dietitians, speech therapists, radiologists. I thank everybody. So over the time, I have, every single time I've thought, if there's something worth doing, you need to train for it. It's not just going to happen. If you have a dream and you have something you want to work towards, make sure your goals are smart. You write them down. It's measurable. It's time-bound. It's achievable. It's realistic. Find people who will support you. Be ready to roll your sleeves up and do the hard work for it. Pray. I'm a Christian, and I pray and trust that God will open the doors for you. The Bible says something, that faith without works is dead. So you need to add something to your faith. It's not just believing that it's going to happen. You can pray and pray and pray and nothing would happen, but you need to go out there and fight for it and work for it.
Fantastic. Yeah, I mean, that's an incredible journey. And sometimes when you listen to that and you plot that on a graph, scientifically, it's tempted to think it's a very smooth graph that goes, exponentially at some point. But we know sometimes in life there are setbacks, there are challenges, and, a lot of people may not start at the same level you're starting. They're probably even at a lower level or facing challenges that, while you have arrived at that point, I can only imagine that there would have been some challenges along the way. Would you be able to share some of those with us and how you've been able to overcome them?
Okay. No, thank you so much. So sometimes people just see the story and don't fully understand. They see the glory and don't fully understand the story behind it. And I think it's important to understand that we're all on a journey, and there are good days and not so good days. There are times in life when life is hard and you got to pick yourself up. And I already said to you that, I'm a product of a single mom. That already in Lagos is quite a moment, and all credit to my mom for deciding that she's going to look after all 5 of us and get us through, and we're all doing great now. So that's quite a significant thing. So if you're a single mom out there, you can do it. Your kids will be great. You need to understand that. And then when you begin to talk about training, what challenges have I had sort of in my journey? You think about moving from Nigeria to the UK. And you think that when I started in the UK in sort of 2006, I was staying with my uncle Boson Balogun, fantastic gentleman, and Uncle Kende as well. And he was providing accommodation for me. I wasn't earning any money. I couldn't get a job because in the UK at the time you had to be registered with the General Medical Council, which is a regulatory body. But to get registered with GMC, you needed a job. So you were stuck if you couldn't get a job and you couldn't get registered. So that was quite a big moment. And that's why myself and a lot of my colleagues who trained around that time, we went to do clinical observerships to try and begin to understand how the NHS works and how to work in this system. But those were unpaid jobs. I stayed with my uncle for months or a year, and no pay. And you begin to think, have I got this wrong? What am I doing here? My mom was like, look, if you're not going to make it, just come back home, But you believe in your heart that a day will come, the sun will break through all that darkness. And I kept with it. But whilst you are waiting, whilst things aren't going your way, you need to keep going. You need to keep working hard. You need to keep believing that it will happen. It's like when you put a seed in the ground and it disappears and you can see nothing happening. I thinking, you keep watering it and nothing's happening. Then suddenly it sprouts out. That's how it is. So there will always be moments where it's all quiet and nobody sees you. Nobody knows you. Nobody is interested in you. Nothing is happening. You don't have a job. You don't have money. You don't have anything. But you got a dream in your heart and you're willing to wait for it. So that moment there, trying to get registration with the GMC, trying to get a job, what I did in that waiting moment was I carried on doing my best in St. George's. I was helping in the clinics. I was in theaters. I was learning the ropes. They were showing me things. They were training me. When a job then eventually came up, I went to the interview and I said, I am every single thing on this job description. And it was difficult to argue with. And I could not believe it. They gave me the training job. And I've never looked back since. So when life gives you an opportunity, you grab it with both hands. You work hard to till it, to tend it, to water it. You pray, you do all you can, but by God, you work hard. So that was a difficult moment. And then when you think about that, even getting a job at the time, there were legislative challenges. In the UK at the time, the job applications will say, if you're not from the EU or you're not a UK resident, you will not be considered before a UK applicant. So it's like testing the pool. And then, you go to interviews and you're the only non-EU person there thinking, that's like checkmate, But you go in with belief. You try and understand what is it about your CV that makes you get the job. Forget about anyone's color. Just say, okay, they want the most competent person here. Fine. What have you done that I haven't done? Then you go and study. You go on the course. You go and better yourself. The next interview, you're ready. And that's just how... I remember going to an interview up in Scotland and, everybody was carrying these big folders with all that they had done and they had got it all signed. And I just rocked up with my hands in my pocket and my friend... I said to my friend, Shegun Akilakpa, he's also a surgeon in London in orthopedics now. And I said, there's going to be a trouble today because neither of us are carrying any big folders. This interview is not going to go well. We did our best, but we then went to them afterwards and said, can I have a look at your folder? What have you got in there? Oh, I've done this as well. I've done this. Okay, fine. So this is what I need to do. Then you go and do what you need to do. So for every job I've applied for, you look at the job specification and you go, what do they need in this job? And I'm going to go work for it and make sure I'm the best person on the job.
Yeah, I mean, I do remember those times. So my wife also happens to be a general practitioner and, she's coming to the UK, some years ago. And I remember, getting a letter from the GMC then, really telling them, if you're not a British citizen or from the European Union, the chances of you getting a job in this country is very slim and you should consider what you want to do on the training. So I know some of those, could be very intimidating. I think that brings us to the next question around, some of the institutionalized challenges that comes with being Black in the medical field or in the UK as an example. I mean, what is your thoughts or what is probably, your advice to somebody who is, just hitting their head against a brick wall, really driven by some of the, I would say, racial undertones that they believe they are facing, either in the workplace or in the environment? What would be your, thoughts around how we should look at some of these issues and, overcome them as well?
So there is no white or brown or black. We all have red blood in our veins.
It's true.
We are one great hybrid patchwork of humanity. There is no greater or less. There is no superior or inferior. Nobody should make you feel inferior. One of the greatest things that you need to know is that no one defines you. You should not allow anyone define you. You should not allow circumstances define you. You shouldn't allow institutions or culture define you.
Mm.
If you take, I'm going to ask you a couple questions now. If you take a ball, a football, that's the standard football, and you chuck it in a bath water, what's going to happen? Is it going to sink or is it going to rise?
It depends.
It depends if someone hasn't tampered with
but the weight and everything, but it's likely going to float.
the laws are that it will float.
Yes, correct. Yeah.
If we get rough with it and you chuck it in your swimming pool, is it not gonna rise or would it sink?
It will still
It will
float.
still float.
Yes.
If you get really, really rough with it and chuck it in your local, the river next to you, it will still rise.
Correct. Yes.
So the point I will want to make, I'm not denying the existence of all the water or the depth of it or how big it is. Everyone's experience is different, whether you're in a small bath or in a big ocean. It is you we should concentrate on.
Mm.
You need to do something about on the inside, your value system, your belief. You've got to have a belief in yourself that nothing defines me.
Mm.
If you say to yourself, I can do all things, that's the first miracle.
Mm.
You don't blame anyone or blame this, or it would be too easy to say, oh, I had it rough. Everyone's got a history. Everyone's got a background. Just do not let your history or your background or the challenges be your coffin.
Mm.
It's important that you're able to rise above the challenges that we face.
Mm.
So for me, my approach is develop yourself. Do something about yourself. Make sure you're available. You're the best. You're competent. You turn up. I turn up for interviews, and they say, "Well, we want 2 publications." I turn up with 10. We want, So you just do your absolute best. Now, the things that are not in your control are not in your control.
Mm.
You pray about them. Find people to speak to. Don't bottle things up. Because things might be happening to you. So I'm talking about allyship. Find allies. It's important to have allies. And so that others can look at the issues objectively and say, well, actually, maybe we need to do something else. Maybe you need to change location or change your approach, or maybe there's something that you need to change.
Mm.
So that's the second thing. I think it's important also to have mentors. I've talked about mentors before. In my journey, I've always had mentors, and they sit me down and they say, Dejo, this is really hard. Do you want to try another job, or do you want to go on a certain course or something? And your mentors are always there. Even now as a consultant, I've got mentors who support me when I do difficult surgery, or that I can call upon Mr. Eniofor in St. George's in London. Hey, Eni, what do I do with this case? Prof. Krishnan and Chloe in Australia, I'll say, should I do this robot case or not? What do you guys think? And if I'm struggling with something, I trust Mr. Tunde Odute, I can bring him up. I've got lots of mentors in the Ibadan Medical Specialist Group. There are mentors for Black surgeons in the UK Black Surgeon Network. There are mentors everywhere. So don't think you are on your own. Do not try and manage the situation in isolation. The other thing is that we should learn to speak out. And if something does happen, there are now processes in place to deal with those. There's safeguarding. There's freedom to speak out. There are people in every organization that you can go to and say, I think I've got an issue here. I think someone's got an issue with me here. I'm not sure whether it's work-related or whether it's got to do with some bias they may have. Speak out, and then you'll find support. So it's a multi-layered response. You've got to respond from within. Do not let anything break you, whether it's a small bit of water or it's an ocean. Be determined to rise. No one can stop you. You are unstoppable. The second thing is, have allies. Don't suffer in silence. Speak to someone. I've had to support people who've struggled with things. Speak out. Use the organizational processes and tools in place. We are all aiming for a fairer, equitable society, regardless of the color of your skin. And that's what there's a history. Yes, we're not denying the history, but we shouldn't allow the history shackle us so much that we can't shape the future.
Wow, that's powerful. And I like the way you stylishly chipped in some physics question there on Archimedes' principle and the law of buoyancy. But, we finally got there in the end, right? And I think, the point you make about, having allies and, I once remembered I went to meet somebody to mentor me, and she was sharing her view of mentorship. And she painted it as, sometimes you may not have a direct mentor, but you have people around you that you can pick up the phone at any point in time and talk with. And I think you've kind of shared a number of, people that, you've called out, that has, helped you to do that. And the next question is really about how you've been able to take all this from the workplace into the community. You mentioned that you do a lot of community work, and I think your example about your NYSC, and for those who don't know the National Youth Service Corps, in Nigeria, you will spend a full year anywhere in Nigeria, and not just, the nice, cozy places, but sometimes in the village, in the rural areas, and that 1 year could be very difficult for some people to kind of survive that process. But even in the midst of those challenges, you were able to still do something for the community. I don't know if you can share, the things that you've been doing in the community, and what you're doing now as well, in the community, and how it's impacting lives.
No, thank you so much. So I will start from Nigeria, which is where Nigeria is a great country. We're proud people of incredible talent, of resources. You got over 200 million people, and you've got incredible skills and talent everywhere. I am one of those talents. And I think it is all about what you do, your environment, who you are, and the beliefs that we can do great things together. So I will start from the NYSC, the National Youth Service Corps, which we talked about. So I was the local doctor in Owana, in Ebonyi State. And I really enjoyed that year. It was a very impactful year. I did so many things and touched so many lives. It opened my eyes to the huge health burden and the struggles that communities go through. And just thinking about how can I impact on a greater scale more than just the person who comes into clinic. Why has this person come into clinic to see me? What are the reasons in the community? What are the risk factors? What are the practices that I can change to stop them coming in? Is it smoking? Is it child care related thing? Is it how to prevent infection? What is bringing people into clinic? So it's good to have a holistic approach of things and think about the community. This is where my love for public health and community work came in, and I did a master's in public health on the back of that. People coming in with stroke every other week or heart attack sent a signal that there's a lot of unrecognized hypertension in the community. Then I got my fellow UCOR members together. We started checking everybody's blood pressure, checking their sugar levels, and then screened the entire community. I had to work with the elders and the leaders of those communities. Princess Kanuibiam of Owana called the elders together. They sat with me and said, doctor has something to say. And I said, look, we need to check our blood pressure. I had to get them to come into the market square to have their blood pressures taken so the people could see that actually, oh yeah, it's okay if the leaders are doing this. And that's how you get engagement. Then the government started giving us money for drugs and things. So there's a whole lot of impact you can do, even in a rural area. It doesn't matter your location. Just brighten that little corner where you are. So that was coming to work in Nigeria. In the UK, since I've been in Leicester, I've been doing some work with ethnic minority groups. Black, Asian, Eastern European, every sort of group. Black, Pakistani, every group. And what I've been trying to do with my partners at the University of Leicester, Dr. Giannina Postovaru, who's in psychology, Tamara Khan, the Oracle Cancer Trust, Dr. Naina Patel, who leads the patient and public engagement, and Alex is to try and raise awareness about head and neck cancers. So again, the approach of not waiting in the clinic for a cancer patient to come to me is I go to the community to say, smoking can cause cancers. Excessive alcohol can cause cancers. Chewing pan, chewing metal quid can cause cancers in the mouth or in the tongue. But trying to understand from the community's perspective why they engage in those practices. What do they know? What do they understand about head and neck cancers? Do they even know the symptoms? How do they present? In a lot of our communities, there's this hush-hush. There is this, I don't want my neighbor to know that I've got cancer or something's wrong with me. We bottle things up. How do we engage with communities to open up? They're not hard to reach. We're the ones who need to find ways of reaching them. There's no such thing as hard-to-reach community. We're underserving communities. So we have to find the ways we can communicate better, whether it's in leaflets or videos or CDs or whatever. We need to go to them. We seem to think that they should come to us. So community engagement is pretty powerful. So the work we've been doing, raising awareness around head and neck cancers in Leicester and Leicestershire, we've had tremendous success with that. We'll be producing campaign videos, working with the communities. And again, we go back to what you said about representation matters. Those videos will have members of the communities in them, speaking in their languages to their communities to say, that's Yoruba, I've just spoken. Those who know, and they will listen to me, saying, look, don't smoke, smoking causes cancer. If you get someone who's like you saying that to you, you're more likely to listen. Representation matters. So that's where the community engagement has been at that level. And we do a lot of work. A lot of my colleagues up and down the country and in Nigeria do a lot of community work in Ibadan as well.
Excellent. Right. So, as we are gradually, winding down this conversation. Yeah, I mean, there's definitely still a lot to talk about, and we will. I would also like to remind our viewers on Zoom to drop your questions into the chat. At some point, we will pick up your questions. So if you do have questions for Dr. Olaleye, we'll pick it up, shortly. So we've looked back, we've seen where you are today, and we just want to get a glimpse of what's the dream.
So thank you so much for that question. So I think it's all about Thanksgiving. So when you begin to reflect about how far I've come, how far you've come, if you begin to think about your journey, the very first thing has to be Thanksgiving. Because, there's a song I really like that says, you made a way.
Travis Green.
Yes. Yeah. Can I sing it?
Of course. I can join in if you don't mind. Yeah.
You made a way when our backs were against the wall and it looked as if it was over. You made a way, and now I'm standing here only because you made a way. You moved mountains, you caused walls to fall with your power. You perform miracles. There is nothing that's impossible. And we're standing here only because you made a way. Yeah. We're standing here only because God's made a way. So none of this is about me or how I can study or how I can do one thing or the other. Or I can set up a program or I can travel the world. God, in his infinite mercies, has decided that Dejo from Surulere, from a single mom, will rise and become a consultant head and neck surgeon doing robotic surgery. It's got absolutely nothing to do with me. This is God's providence. This is him making a way for me. This is God making a way for you. Regardless of your challenges, regardless of where you're starting from, regardless of the limitations, regardless of what life has dealt you, it should not be your coffin. You need to rise above it. You need to go, I've got a dream in my heart. I'm willing to work for it, and I'm going to be great. So for me, the reflection is about Thanksgiving, and not just to God, but to my family and to every single person along that point who has made a difference for me. So today is more about everyone who's helped me, who stood by me, in my childhood, by my siblings, Larry doing Software VC, we were in the situation together and we supported each other. It's about my secondary school colleagues, who I've got a very strong group of friends. Ideme, Oye, Kunle Lawa, Kunle Alonge, all of them. There's so many, the entire Pouch 98, who are always there, who are always encouraging, who we studied together, and who we said, look, we can be great. We can be the next generation of great doctors. It's about my mentors who I met along the way from secondary school in Ogbomoso with Mr. Olaleye to the Ibadan College of Medicine, Dr. Adegboye, Mr. Akute, all these great people, to the people who God placed along my path in the UK, Mr. Dutoye, Mr. Ayo Showo, the IMSG group. It's about the people who continue to support me now. My colleague, Mr. Peter Comboy in Leicester, it's a great, great guy, NEO4. So it's about all of these people. And my wife, who is absolutely phenomenal. Jai, this is for you. She has supported me. None of this stuff we're talking about will happen if my wife wasn't supportive. She's been there through thick and thin, day and night. All the fellowships that I've gone, I'll quickly say, so when I went to Norwich, it was about 3.5 hours away from home. So I had to stay there during the week and come home on the weekends. Jai looked after our two girls, Ruby and Lily. So she kept that dream going. She so you don't worry, you go do your thing and, come back home. And then took everybody to Australia. She went with me to do the robotics. And they had a great time. So it is about saying thank you to all of those critical people. So when you see a success, it's not just the success, it's an entire village, it's everyone. So going forward, what I would pray for is that I am able to establish very firmly the robotics program in head and neck cancer in Leicester, working with our fantastic multidisciplinary team, because I genuinely care about patients, and I think if we can help cancer patients and restore them back to their families, I think it's worth the world. So I'm hoping in the next couple of years we can train more people, the program can grow. I direct the Head and Neck Cancer Research Institute. I'm hoping that we will continue to do a lot more research around how do we find better treatments, less toxic treatments for patients. How can we improve survival? And how can we improve quality of life? So I'm hoping in the next few years that I would see that grow. I will work with the University of Leicester. Hopefully, someday I'll be a professor of head and neck surgery. I'm looking forward to that. I'm speaking these things into life today. I'm hoping that I will continue to impact on the communities, the work that I do in Leicester and beyond, and get people to engage more with health issues. Prevention is better than cure. So the quicker we can get people to understand what causes disease and to prevent it is better than curing it. I would hope to continue my work as a research and education secretary for the Ibadan Medical Specialist Group. So we go to Ibadan every year to run a symposium. That's my responsibility, and Dr. Bode Williams, who's our president, and the team. And we teach online residents. So we're giving back to Ibadan and to Nigeria with our skills by teaching and training and, mentoring residents to saying, you can do this. So I would hope to do a lot more of that in the future as well. I hope to be a great dad to my two beautiful daughters, Ruby, who's 12, Lily, who's 8. I want to be a role model to my girls. I want them to see what a great dad can be, and that is one of the biggest things I could possibly achieve. I want to be present in their lives. I want to be there for them. I want them to look at that and go, wow, I can be anything. Ruby's talking about, she keeps staring into space and wants to do, all the space type stuff. I want them to dream and believe that they can be anything. I want to be a loving husband to my wife. It shouldn't just be all about surgery or research or all of that. It's about the home front thing. I want to love Jai for the rest of my life. Wow. So I want to do all of those things. Be a great dad. Be a great husband. Continue to be a researcher. Be an innovator. I've been working with the Rolls-Royce Group to develop a flexible robot, and we haven't gotten to talk about that. But that's called the Cobra, and basically it's like a snake. It bends where you put it. So you can put it in the mouth and you can bend to a particular place and you can work on it. So I've been working with them in the last almost 2 years to develop that into a flexible robot that you can operate with. So I'm hoping in the next few years we would get even a better robot for head and neck cancer surgery. So there's so much of life, and I can only pray and hope that God will make these happen and He will keep making a way.
Awesome. I mean, you're a man of many hats, and it's great to see that the dream still goes on. You never stop dreaming. Success is not a destination; it is a journey, and it seems like you're still on that journey. And we can only wish you all the very best as well. We would see if we can pause to get some questions online. So if you do have questions, please pop it into the Zoom chat. And we'll pick it up shortly. I think with that, we will take a very short break, and we'll come back in a minute or so to take some questions from the audience.
Thank you.
All right. Welcome back, and thanks for staying online while we had a short break. So we've got some questions in Dr. Olaleye. From our audience on Zoom. And we also have some very good comments. So thank you to everyone, who's given a big shout out to the work that you are doing. They're really, really impressed about the passion and the enthusiasm that you've shared with us today. We've got a few questions. So there's a question here asking, did you ever want to quit at any point in your career, and what kept you going?
Did I ever want to quit? I'm not a quitter. So this is the issue you're going to have, because I've always believed that my dreams will come to pass. Every great miracle starts with a belief in your heart that, it will happen. And it doesn't really matter what's happening outside. It doesn't matter if you're unemployed at the moment and there's no money and no one's giving you a job and nothing is moving. You just have to think, okay, where do I want to get to? How do I get there? How do I improve on my CV? How do I become more employable? So this is for the young people out there. You can go and do, like I did, observership. You can go and do internships. They might not pay you for it, but you will get the skills that you need to move into a workplace. So it's about improving yourself. There were difficult times. And I think, when you think about, when I said I'd been in the UK for about a year doing clinical observerships in St. George's. I was staying with my uncle Bosson in London at the time. He was looking after me, but I wasn't earning any money. So, it gets to a point where you think, at what point are you going to go, I'm going back to Lagos or something like that? Or, your friends, you hear this news about your friends setting up they're now doctors, they're setting up their practice and stuff, and you're there in the UK doing what? So I think you just have to understand that your journey is different to the next person's journey.
Oh.
Don't compare yourself to someone else. Don't say, oh, he's making it. Why aren't I making it? You need to think about, what is it about me? What do I want to achieve? What's the dream in my heart? Do I believe in it enough and want to fight for it enough to continue to work? It might be that you need to change what you're doing, because hard work doesn't mean that you're doing the right things. You need to work smart. So, there were moments there where you think, well, I can't register with the regulator. I can't get a job. There's no money. Am I in the right place? So you should evaluate that. But I stuck with it. And in that moment of waiting, remember that seed that's under the ground and nobody sees it and nothing is happening. And then suddenly something happens. But you have to be actively doing something when you're waiting. And what I was doing when nothing was working was still going into the hospital, still seeing patients, still helping in surgery, learning the ropes, making the critical connections, getting to know people, learning the culture of the NHS. And when the opportunity came, I was ready. So opportunity favors people who are prepared. So you got to be ready when they say, right, we need someone who can do X. I say, yeah, I'm here. So at the interview, it was, I am everything on this job description because I've done every single thing they needed. So, I haven't, thank God, come to a point where you think, I'm going to give it up and go. I've come to accept that life is in phases.
Yes.
Men are in sizes.
Yes.
Despise not the days of small beginning. You will start small, though your beginnings be small. Your end will greatly increase.
Excellent. That is, very powerful. And we've got another question here about what does a good day look like today? We hear the stories of surgeons, 2 a.m. in the night, still in the theater. But what does the day or the night look like when it's a good day?
So the work that I do in the University Hospitals of Leicester as a head and neck cancer surgeon means that I do clinics. So I see patients and they come with their relatives. They might have, and the symptoms could be a sore throat, a change in voice, or losing weight, or if you notice a lump in your neck or any of those things, please go see your GP. They'll refer you within 2 weeks. So that's a plug. And I think when I see a patient, I listen, I examine them, I use the camera, I put it up their nose, have a look at their voice box, their windpipe, I do all of that. I request for scans, I get biopsies, but I work as part of a very, very cohesive multidisciplinary team, oncologists, dietitians, speech therapists, surgeons, everybody. And then we take all those investigations and I go to meetings. I go to a cancer meeting where we look at every single patient's tests and biopsies and things. And then we say, okay, this patient has this cancer. This is how we're going to treat it. If we're going to do surgery, then I would organize surgery. So another day would be me in theater, again with my team, my anesthetist, Dr. Ramesami, Ellie Whiten and co. They put the patient to sleep. I operate on them. There are different types of operations that I do. Some operations are taking out cancer in the back of the mouth, the tonsil or back of tongue or voice box area. Some operations require me to take out a thyroid gland in the neck. I spent about 5-6 hours yesterday doing that before today. So I was all day in theater yesterday operating. But the joy at the end was speaking to the patient, checking that all the nerves were working, speaking to his family and his wife and saying, he's absolutely fine, he's coming home to you. And he had given people a new hope that, oh, yes, I can go back to my family, I can go back to my work, the cancer is gone. That is what drives me and gives me joy. So that's what, the days are long and can be challenging, but the joy is seeing cancer patients get better. So that's what I tend to do often on a week, a clinic. It could be a cancer meeting. I do surgery. They could be long hours. Some operations are really long when you take out the entire voice box and you reconstruct it. But the end goal is that patient gets better. And I also spend my time doing research. So I really enjoy meeting with our research teams, Venadine and Louise and Tracy Robinson and co. and Kelly Bowes, and saying, okay, we're running a few clinical trials in Leicester where we're trying to find better ways of treating patients and following them up. How are these trials going? That gives me joy because I know that's the next thing that will happen. And then there are days when, you do lots of admin, you sign clinic letters, my secretary keeps me on the straight and narrow. Michelle, she sent me a text this morning as well. So, so Michelle and the secretarial team do a great job. So there's admin work. I teach students in the University of Leicester as a honorary senior lecturer there at the moment. And I was teaching 2 days ago and talking to them about head and neck cancers and lumps and things like that. I mentor and I teach in the UCH Ibadan as well, online with the IMSG group. So I do a whole lot of different things during my day.
Excellent. Wow, that looks like you've got more than 24 hours in a day.
It's a whole week.
Yeah.
That's a whole week.
Yeah.
Not just one day.
I think the last kind of few questions we've got is about, you do all this. How do you unwind? What is your hobby? I mean, how do you kind of run away to unwind from a lot of things that you do during the week?
Yeah, no, thank you for that. So it is absolutely important that you're able to de-stress and get away from all the noise and all the pressure for your own mental health, for your own sanity, for your family's well-being. And you can't do it all. You've got to understand that work will always be there. If something happens to you and your health fails, or they're going to employ someone else. So you need to look after yourself. So that's quite important. How do I unwind? When I finish in theaters, in theaters, I like music.
We can tell. Yeah.
So there's always some music going on in the background. I don't know, Adele or something like that. I like Adele's music, or Ed Sheeran or one of the team, and there's music going on. We debrief. I say thank you to the teams. I think it's important that everybody feels that they've been part of whatever you've been doing. It's always about teamwork. It's not just about you. I see the patients afterwards, make sure everyone is fine. I send a message to my wife that I'm on my way home. Jai is absolutely brilliant. She would have sorted the girls out. They'd have had dinner. I drive home. I get home. Hopefully, still enough time to engage in bedtime stories and read to Lily or pray with the girls before they go to bed. And then I try and unwind. I play chess. Okay. So I'm an online international master in chess. Wow. I'm an AIM online with FIDE, So I play chess tournaments. I play regularly on chess.com every day, every evening. Wow. I solve puzzles. I played in a few of the UK tournaments whenever I can get out of theatres to the British Championships or something. And so I really enjoy my chess. Chess teaches you a lot about critical thinking and problem solving and staying with the matter and staying with it till you solve it. You're not giving up on this. And it also teaches me to understand that every piece is different. In a team, everyone comes with different skills. When I need to use a knight, when I need a bishop, when I need the queen to go straight in, checkmate. And you deploy everybody to achieve one goal, to either win the game or at least get a draw. It teaches me about sacrifice, that I can give up something that looks big. I could sacrifice my queen, but you still lose the game. So it teaches me to choose my battles and move things around. So I think I really enjoy it. I've been teaching my daughters chess as well. So we play, they still can't beat me yet, but, the Ruby keeps thinking she will. So I play chess with the kids. I enjoy swimming. So I've been going to swimming lessons, both when we were in Australia and when we came back to the UK during COVID. Everywhere was shut down. As long as you don't forget to breathe, you're fine. So I've been doing swimming lessons, and I think it helps me zero out and just relax and enjoy, either the water or the chess. Or chess takes me away from everything because I'm concentrating. I'm the current Leamington chess champion. So I play for my local league. I enjoy music. So I write music as well. I listen to gospel music. I'm part of the music team in church. I'm a part of a local church, Jubilee Church in Coventry. With Pastor Andrew Simpkins and Pastor James Noble and Paul. So all of that. And you for me as a Christian, God's word washes over me. And I can think about the stresses I'm having or what I'm about to do, and I can find a word that speaks to that. Or an encouragement on a Sunday morning, or a song or something like that. So Sundays resets me, and then I'm ready to go again. So chess, swimming, listening to music, being part of activities in church and things. So those are things that that I do to distress. I speak to my wife a lot about what I'm doing, and as you can tell, I talk a lot, and she's quite quiet. So she listens to what she can, and the rest of it another day. So yeah.
Well, fantastic. I mean, thank you so much, for sharing all this with us. With that, we've come. Unfortunately, I would say, because this is a conversation that I'm sure a lot of people might want to keep listening to, right till the evening, perhaps. But we have to, cut it short here. But we want to say sincere thank you for, joining us. Thank you for your invaluable insights and, word of advice as well, to the upcoming generation and to the older generation. And we're excited to see the incredible impact you're making at University Hospital Leicester and in and around your community as well. So thank you very much. And thank you to our, audience that have joined us via Zoom. We appreciate you for coming. But just before we go, we've got to present something to Dr. Olaleye, and I would like to invite the convener of the Black Excellence UK to do the presentation on behalf of Black Excellence UK.
So this is from the community, let me put it that way. For all that you've done, all that you're doing, and all that you will continue to do. This is just our own way of saying thank you. There's so much packed in what you've said today, and we'll still be unpacking it over the next few weeks, over the next few months. But thank you very, very, very much.
Thank you so much. Thank you. Thank you so much, sir. I really, really, really appreciate it. This means a lot to me, so thank you. Really appreciate it. Thank you all.
Okay, thank you very much, everyone, for joining. So we've come to the end of the conversation today, and would like to encourage you to join the Black Excellence UK group. You can go online and search Black Excellence UK, where you will see some of the other interviews we've done with amazing talent like Dr. Olaleye, and we are also looking to do more interviews with people of color that will further inspire the young and the old generation. I think with that, we just want to say thank you very much once again, and we wish you continued success in your career.
Thank you so much for this. This is incredible, and I just want to dedicate this to my mom, my siblings, my wife, my daughters, my friends, colleagues at work, and all the amazing people who continue to do great things. It's all about teamwork, and this has taken a village. So thank you.
Thank you very much, everyone.
Thank you.
Bye for now.